Impact of hearing loss and restricted access to care on the Karen people living in a conflict setting near the Thai-Burma border. This study addresses issues of hearing loss for people living in a chronic civil war zone in eastern Burma, the Karen state. In December 2023, in brigades K4 and K6 in the Karen state, patients were recruited by word of mouth during a combined vision and hearing clinic. The Institution Review Board approved study was translated in culturally and language sensitive manner and discussed before written consent. The hearing handicap inventory for adults was adapted to the environment and translated into 4 languages common to this region. Patients who came to the clinic for a chief complaint of hearing loss had ear exam, and then audiometry was performed on each patient. There were 22 patients who presented with hearing loss during the combined vision and hearing clinic. At the same time, 22 hearing loss patients were seen. 26 patients had cataract surgery. The average age was 55 years. A few more were male. Only 9% had had any previous hearing treatment. Ear injury was present in about 1/4, and many had injured their tympanic membrane with chicken feather. Noise exposure was common, and military noise exposure was approximately 1/5. There was a family history of hearing loss in about 1/4. Again, harmful exposure to high noise was fairly frequent, coming from everyday life within motors, but also military conflict was common. For prying hearing care, the majority had no prior hearing or ear care, and many of those with no prior care expressed the reason for no prior care as an issue of military conflict. There was a significant correlation between the HAI survey and audiometry in score safety, score HHI, and score total. In conclusion, hearing aids were dispensed to many of the patients demonstrating hearing loss. The survey adapted to this cultural group and translated in 4 languages was useful for assessing perceived hearing loss, and it correlated with audiographic care. Continued use of a similar survey and audiography with provision of hearing aids should be a significant improvement in healthcare in these patients living in conflict area.